Welcome everybody online, and I am so glad you are here too. We're having a ball, and I'm really sorry you missed the good food. We had Mexican in honor of Carly, and I really thought about making margaritas to go with it because that is part of the experience, but I didn't think it would go well because this crowd is rowdy enough as it is. So we did not do the margaritas. For those of you who have wanted to take my pediatric Feeding the Big Picture course, which I taught for several years and then stopped teaching when I got sick, I thought this would be a way to kind of get back out there and teach it, but in smaller chunks that I could handle, and that would be incredibly cheap and convenient for everybody else. Because as you know, people are getting the module for $10 if you're watching live or here, and then later on demand it'll go up to $20. But still, I want to get the information out. And so what we're going to do, something I want to do, and I'm going to do this with each module, is recommend some resources. So if you are new to feeding, or you're trying to remind yourself, or you suddenly came into a lot of money and want to invest it in your library, I have some recommendations. And so for today's module, these are the two that I always recommend first. If you have no other, if you buy none other, buy these. And it is The Source for Pediatric Dysphagia by Nancy Swigert, and Pre-Feeding Skills by Morris and Klein. Now, oh yeah, this one is the Pediatric Feeding Bible, and I've never had a kid ever that there wasn't something in here that helped. Now, I do know that they're working on another edition, but I don't know how long it will take. So if you have kids between now and next week, get this. Just get it now.
There's just so much information.
Yeah, there's just so much. It's just...
It is pricey, but it's
It is.
worth it.
In the United States, it runs about $80,
I think it's
90,
like 90, 95.
$95 in the States. This one runs about $40 in the States, USD. So if you are really strapped, start here, but ask for this for your birthday or whatever else, okay?
Well, it's my birthday tomorrow. I'm ordering it.
We should all pitch in for it for you, right? Okay. Now, I think we're down to starting on the actual PowerPoint. Okay, first of all, what you are going to learn tonight is the foundation for feeding. We're not going to get into the really jazzy, exciting, juicy parts tonight. No pun intended. But you have to know this stuff tonight in order to do any of the rest of it with any kind of competence. And unfortunately, I know that I've been to a lot of courses that never mentioned what we're going to go through tonight. I'm actually going to give you the answer to when to treat, when not to, when to push, when not to, and how do you know when to stop? How do you know when you're done in therapy? Is it just because whoever was paying for it stopped paying? Ethically, when are you done? So we're going to cover those. Here's my disclosure statement. CEU Espresso is the company that Jim and I have formed to try to get the stuff that I teach out there. So I have an ownership interest. I'm an employee who receives a speaker fee. Well, I will someday. As of yet, no, still haven't. We're still putting money into the company. We're still in that stage. And Feeding and Dysphagia Resources, it should have a comma PC after that. That's the name of my private practice. And I have ownership interest. When money's coming in, I do get a paycheck as an employee, and I do occasionally pay myself a speaker fee. All right. Also, before I forget, my website is Feeding and Dysphagia Resources with dashes between it all. So if you ever need to try to find me, there it is. If you are watching this broadcast and you're not a member of the Feeder Facebook Dysphagia group, you need to get on there. That is the neatest group of fantastic professionals. We help each other, we reach out, we encourage, we applaud, And as I've said many times, it's a snark-free zone. You are not allowed to get snooty, you're not allowed to shame anyone, you are not allowed to look down on anyone or say, that was a dumb question, none of that. We are gonna treat each other the way we treat our patients. So that is feeder, and that is capital F, little EEDR. Bumper stickers. Y'all have heard. And yes, I'm saying y'all just because I'm in Texas in the United States, and y'all is an absolutely terrific second person plural pronoun. Okay, we are going to have bumper stickers today because, as you may have heard, when you attend a lecture, you retain about 20% of what you hear. Now, if you're leaving a lecture on pediatric feeding and only retain 20% of what you heard, you can still kill somebody and a child. So I don't want that. I'm trying to change that. So what I will do today and through the rest of the modules, and there will be 4 modules total in this particular course, I will give you bumper stickers. And these will be phrases or words that you can write down on your notes and say them to yourself in the morning when you're putting on your makeup or when you're exercising. If you just remember these bumper stickers, it will pull up for you the most important points in this course. Okay? Relax and have fun. As you can tell with Feeding Fun Night, that's what we do. Working with pediatric dysphagia is the most incredible place that you can work as a professional, I think. Being able to help a child eat is incredibly fulfilling. But you have to have fun in the therapy, right? Because eating is supposed to be fun. So I also want it to be fun when you're learning about it. And the last thing is Lyme, and I'm not going to go into this much. I want to breeze by it pretty quickly, but I have been suffering from chronic Lyme disease for the last, it's 6 years now, guys. 6 years since I got back from China. It was July 12th, 2012, but who's counting? And I have learned a lot. I have learned a lot about what it's like to be the patient, a lot about why. Have you ever had that family that you're like, they just keep whining? I get it now why they're whining. They've lost their life as they knew it, and they need to grieve that. And I've learned that the hard way. And I've learned how something that someone says that, you know, they just said it because that's a phrase that we use or something people say to cheer you up. And unintentionally, they just crushed you. And we have done that to the families that we serve. And so I will be bringing that into my teaching too. Now, the great news is, and I know this doesn't mean that it's for always, but I have been going great for 2 weeks, guys. I mean, I've had 2 weeks that this is the best I have felt in the whole 6 years. And there was a medication change, so I'm honestly hoping it is due to the medication change, because then I can keep taking those pills. If I don't know what made me feel better, I can't keep doing it. So I'm hoping. Now, another book I want to recommend that I don't have because I just asked Robin today. Robin Rembecki, OT, and a very good friend of mine. We have been buds for like 20-something years. I asked her today, I said, okay, what's a good resource for SLPs, RDs, somebody non-motor to learn and get the gist of gross motor development for peds? And she recommended this book. And the reason that I'm bringing up gross motor is because we're going to talk a lot about that today. So this is not in the handout, so you do have to copy it down. Your Child's Motor Development Story, and it's by Jill Howlett Mays, an OT, and it's on Amazon.